Doctor? Hello, are we all here?
Yes, please.
Okay, thank you. So, as I said earlier, we'll be having a health talk on SCIATICA, and it will be led by Doctor. But before that, let me introduce her first. She completed University of Health and Allied Science. She worked in Kumasi South Hospital and currently working at 21st Clinic, which is located in Tema, in Ghana. And then, as you all know, Jesus Foundation is a charity that is based in UK, but we provide service to people in Ghana as well. So without much ado, I hand over the platform to Dr. Abigail Asiedu. You can take over.
Good evening to you all.
Good evening, Doctor.
Please hope you are all doing well.
Yeah, we are good. Yourself?
By grace, I'm doing very, very well.
That's good.
So as we all know, today we are coming to learn something about sciatica. Pardon me with my camera, it's not that good. So we are all welcome to today's wonderful platform. And thank you so much, the SCIATICA Foundation, for this opportunity. Please, I hope you can hear me well.
Loud and clear. We can hear you.
Okay, thank you. So please, we are talking about sciatica. So anytime we hear of sciatica, is something that it seems we've not heard before. But sciatica simply means a condition that affects the sciatic nerve. So first of all, we have to know what nerves are. We hear of nerves, what it does. So we will look at an introduction about the nervous system. So when we talk of nerves, so they are whitish fiber or bundle of fibers in the body that transmit impulses of sensation to the brain or spinal cord, and impulses of these to other organs and muscles in the body. Please, can you see my screen?
Yeah, we can see. We can see it. Yeah.
Okay. So with these nerves, they serve as the body's electrical wiring. So there are about 7 trillion of nerves in the human body, but we are taking one aspect of it, which is the sciatic nerve. So the way we have electrical wires in our various homes and houses, the body has electrical wires, which are known as these nerves. So these nerves serve as for us to respond to sensations, stimuli, impulses, every movement that we do. You sitting, getting up, eating, throwing your hands, almost everything is as a result of these nerves that enables us to do that. And it works in accordance with the spinal cord and that of the brain. So some functions of these nerves are, it gathers information from both inside and outside of the body. It transmits information to the processing area of the brain and the spine, as I said earlier. It also processes the information in the brain and the spine, and also sends information. So when you even step on a needle or any hot substance, it's these nerves that will send information to your brain that this thing is hot, so take off your leg from it. So that's some of the functions of the nerves. So that's the functions of the nerves in general. So we are looking out the sciatic nerve. So with this sciatic nerve, is the longest and the widest nerve in the human system, and it's located at the lower back. That's from the waist, which radiates through the hip, the buttocks, the thigh, down to the legs, and it travels as far as to the feet. That's the location of the sciatic nerve. There are images of it, so when we get there, you will know. So this sciatic nerve, that's the location. So it's located at the lower extremities. It starts from the lumbar side, that's the lower back, and radiates through the hip, the thigh, the legs, travel as far as to the feet, as I said. So that's the location of the sciatic nerve. So these are the contents of my presentation. You look out the anatomy of sciatica, its types, causes, and so on and so forth. So with the image I have here, you can see there is a reddish area. That's from the buttocks of the human parts indicated there. There is a line that has a yellowish color that's radiating through the thigh down to so that's the sciatic nerve. But basically, it's not in only one leg, it's found in both legs, but that's the image I'm showing there. So that's the sciatic. So it starts from the lower back, that's the waist, the middle of the waist, through into the legs to the feet. So that's the sciatic nerve. So you see, when we take the back is divided into about 4 parts or 4 regions, the human back. So we have the cervical spine, taking the spinal cord into consideration. We have the cervical spine, that's the upwards towards the neck. We have that of the thoracic spine. That one is the middle. Then we have the lumbar spine. That one is getting down to the waist. Then we have the sacral region. So that one is down on top of the anus. So that's the division. So with this sciatic nerve, it actually starts from the lumbar spine. That's the lower back, and it radiates downwards. So that's the location of the sciatic nerve. So when we talk of sciatica, as I said, the name is too big and whatsoever. So now we know the sciatic nerve per our indication. So when this sciatic nerve is affected with any condition, or there is any inflammation to this sciatic nerve, which that's called the sciatica. So sciatica simply means a pain that originates from the lower back through the buttocks, the hip, and travels into the legs and as far as to the feet is concerned. That's simply the meaning of sciatica. So when there's a problem today, or when there is any condition that affects the sciatic nerve, it's known as sciatica. So please, as we can see in the diagram, the sciatic nerve compression. So that's the nerve, the thin line that passes from the pelvic side downwards, as indicated in the slide. So there are types of sciatica. And people go through this condition, but sometimes it gives them some signs and symptoms. It goes off by itself. They don't do anything to it. They don't even know what's going on. So there are various types of this sciatica. So we have acute, we have chronic, we have alternating, we have bilateral. When we take the acute sciatica, the acute, anytime you hear of acute simply means short period. So when this pain, this sciatic pain, because now we know the sciatic nerve already. So when this sciatic pain, it occurs within 4 weeks to 8 weeks. So from zero day to 8 weeks. 8 weeks is like 2 months. 4 weeks is like a month. So when this pain occurs within from day 1 to 4 weeks or to 8 weeks, it's classified as acute. And such pain can go by itself, maybe through self-management, by you working on your own. Maybe as soon as you started experiencing such symptoms, you started working, you avoided some 1 or 2 things that you were doing, and it just went by itself without applying any medication or any treatment to it. Then it went by itself. So within that short period, so from day 1 till you started experiencing the symptom, so 8 weeks or 2 months, within that period is classified as the acute sciatica. Then with the chronic sciatica, so acute is short term, so it's 4 weeks or day 1 to the 2 months you start experiencing that. Then the chronic is the long term of the condition. So this one is 8 weeks or more. So if this condition is there for about 2 months and even more, and it has been constant or persisting, with you taking any other things, so the pain persists, it's classified as chronic sciatica. And this one can be as a result of you going into surgery, or without, it's non-surgical. Sometimes, depending on the stage, maybe you'll be recommended to go in for a surgery, or sometimes through medication, you'll be fine. Some people go under physio and they are okay with it. So when it's 8 weeks or more, it's classified as the chronic sciatica. Then we move to the alternating sciatica. The alternating sciatica is the pain that affects each leg alternatively. So it can start with one leg, maybe the right leg. It can start from there. You go through pain, you feel some numbness and others. Before you realize, the next day to move to the left leg. Another time it will be in the right leg. So you yourself don't even know where the pain is. So today it's here, tomorrow it moves to the left, today it's in the right. So the way it's doing is simply termed as the alternating. So alternating sciatica. That means it affects both legs alternatively. Then we have that of the bilateral sciatica. So the bilateral sciatica affects both legs. So since it started, it can start from your waist or the lower back. Then it will affect both legs directly. So from the waist, you feel the pain through both legs, the thigh, the hip, the legs, the feet. You feel that from the one it started, or the one you started experiencing the symptoms, it started affecting both legs. That one is termed as the bilateral sciatica. So there are 4 types. So we have the acute sciatica, we have the chronic sciatica, we have the alternating sciatica, and that's of the bilateral sciatica. So there are so many causes of sciatica, a whole lot of sciatica. So we will just glance through some of them, and to our level, we will understand everything. So please, I'll start with the herniated disc or bulging disc. So this one is, there are some intervertebral discs or soft cartilage that lies in between each disc. So this is like when we take the spinal cord, bone by bone by bone. So with this soft cartilage, they lies in between each bone, so that bone 1 and bone 2 wouldn't come together or wouldn't scratch each other. So this, there are some soft cartilages that serves as shock absorbers that lies in between each vertebrae or each disc. So when we take 2 bones, there are something in between it. They are known as the soft cartilages. So when you take chicken, or maybe when you're enjoying your food, you have chicken on it. After you chewing the meat, you see the bone. When you chew it, there's some soft pushing in between with the brownish color. It's very sweet when you are enjoying your food. That particular thing, when it comes to the human system, that's what we call the soft cartilage or something. So they lie in the chicken bone that you are taking. That one lies in between 2 bones. So here, when it comes to the herniated disc or the disc I'm describing, that one is the soft cartilage that serves as the shock absorbers, which lies in between the 2 bones. So with this one, it can there can be a trauma or injury to it, whereby it can come out. As a result of that, it will pierce the nearby nerve, which is the sciatic nerve I'm talking about. So with the lumbar side, when we take the lumbar spine, that's the lower back, that side, if there is a problem with, let's say, L4, L5, and this soft cartilage is in between, when there is a trauma or injury to that cartilage, can come out of that hard bone that we see. It can come out of it, and it will pierce or it compress the nerve, the nearby nerve, which is the sciatica. So when it happens that way, it's classified as herniated disc. So your condition, through herniated disc, you've gotten sciatica. So that's one cause of the sciatica. Then we have osteoarthritis. Osteoarthritis simply means inflammation of the joint bone. So we have our wrist as a joint, we have the waist joint, we have the knee as a joint. But right now, what we are talking about the lower extremities. So the waist is a joint, the knee is a joint. So if the joint bone is inflamed, or there is a problem with these joint bone, it can lead to sciatica as a result of it putting pressure on the nerve. So osteoarthritis, it can be through aging. When you age, we know that there are some diminution of tissues, cells, and bones. They weaken. So when it happens that way, there can be degeneration, and all these things can cause sciatica. So osteoarthritis is one cause of sciatica. Then we go to spinal stenosis. Please pardon me with my words, but I'll break it down for you. So spinal stenosis simply means narrowing of the spinal canal. So when we take the spinal cord or the spinal system, so let's image it on it. Let's take an image of it. When we take the spinal cord itself, there are spaces in between. But right now we are dealing with the lumbar spine downwards. So there are spaces in between the spine. So there are vertebrae 1 and vertebrae 2, or this 1 and this 2. There is a space in between. This 2 and this 3, there is a space. So when there is the space there, the natural space, when it becomes narrow or it becomes small, it compresses the nerve roots. So the nearest nerve, it compresses it. So when it compresses, once it's compressing, it's creating inflammation to the nerves. So what you will experience is pain. Please, I hope you are understanding it. What you can experience is pain. When there is narrowing to the spine. So the spinal stenosis is the narrowing of the spinal canal. So the spaces, the natural spaces that are supposed to be in the spinal cord, when it becomes smaller, and with these ones, hard work can lead to that and others. So when it happens that way, there will be some compression to the nerves due to irritation, because when the spaces become small, that means something is not going on well. Something has gone into a different state. So it will be compressing the nerves until it comes back to its normalcy before the nerves will be okay. So spinal stenosis is one cause of this. Spinal narrowing or narrowing of the spinal canal is one cause of sciatica. Then we have the spondylolisthesis. So with spondylolisthesis is when the vertebrae, so the bone, the disc, they are called the vertebrae. So when the vertebrae, maybe some move upwards, one will move downwards, one will move sideways. It's not supposed to be like that. Naturally, it's not supposed, they are supposed to be in line. But this spondylolisthesis occurs when one vertebrae moves upwards, one will move downwards, sideways, adjacent. When it happens that way, that means something has happened. It's not in the normal state. So as soon as one vertebrae slips from its normal route, it will compress the nerves or it will pinch the nerves. So whilst it's pinching, it's irritating it or it's causing inflammation. Therefore, there will be pain. So you have sciatic pain as a result of spondylolisthesis due to the slip of any of the vertebrae at the lumbar side. So spondylolisthesis is one form of it. And we have the muscle spasm. So muscle spasm, we know the back. When we talk of muscles, it's like your body flesh, you know? That's muscles. So muscle spasm is like contraction of the muscles. When it happens that way, there is too much pressure on the neck. It also puts pressure. So that's one form of it. So these are diagrams or images of the causes, some of the causes. So you can see by yourself. We have spondylosis, we have lumbar spondylolisthesis, we have radiculopathy. They are all forms of it. So if you can see here, the green part, that's the herniated disc, the cushion I was talking about. That lies in between the bones. So when we take chicken's own is the brownish cartilage I was showing you, but this is how it is. So with the diagram we have here, the second diagram, that's it. So that's how the disc looks like. So when it comes out, it's known as the bulging disc or the herniated disc. So it will rather pierce the nerves. So this is the normal one, and that's the herniated one. Then we have the lumbar spondylosis. So the spondylosis is the degeneration of the disc. And we have the spondylolisthesis, either the disc slipping upwards, downwards, or sideways. They all affect the nerves one way or the other. So please, still causes continuing. So we have sedentary lifestyles or conditions that also leads to the sciatica. So we will take pregnancy. So this one goes to the women. So as you being a female, already you are at risk of getting sciatica in future. So you being a female, you are at risk of getting sciatica in future. When we take pregnancy, for instance, you see, during pregnancy, the womb or the uterus increases or enlarges. Maybe when it gets to 6 months, 7 months, 8 months before delivery, the womb gets into a different situation. As soon as conception takes place, the womb starts developing. It moves into a different stage. So anytime the uterus enlarges, it puts pressure to the lower back. The spine gets into a different state, which is not the normal state. So it's rather the womb, the enlargement of the womb due to the growing fetus. The enlargement of the womb puts pressure on the lumbar, the lower back. So that's the lumbar spine. So anytime that thing happens, there will be compression of the nerves. So the nerves will be compressed for some time until delivery takes place before the spine comes back to its normal state. So depending on the number of times you've gone into labor, this thing has been occurring. So it's there for you. So if not now, later in life, you start experiencing that as a result of complication through pregnancy. So pregnancy can lead to sciatica. Maybe during pregnancy, you start experiencing that, or before you deliver, you start experiencing all these signs. And we'll get to the signs so you know how it is, or you start feeling pains at your lower extremities as a result of pregnancy. So that's one cause of it. Then age-related changes in the spine. So as I said, when you age, there are some weakening of the bones, some tissues and others, they all weakening. So they are all causes of it. And obesity puts stress on, or excess body weight can also contribute to this sciatica because it puts a lot of pressure on the back muscles. So it's another part of it. Then we have occupation. If your job demands prolonged sitting, prolonged standing, you need to check because they are all causes of sciatica. Maybe when you stand for long, when you sit for long, someone can sit to watch telly for about 4 hours, 5 hours without even getting up. Whilst doing that, you are putting pressure on the sciatic nerve. Because that prolonged sitting, you'll be compressing the nerve for that period until you change posture before it relaxes. So prolonged sitting, prolonged standing. If your job demands lifting, bending, carrying, all these things are causes of sciatica as a result of you putting more pressure on the sciatic nerve. Then diabetes is another thing. When you take diabetes, one complication of diabetes, neuropathy. So due to the high glucose in the blood, it affects the nerves. So the nerve damages can be the nerves in the hands, the legs, the feet. They are all causes of sciatica. So diabetes is a cause of sciatica because already the complication of diabetes is neuropathy. So the nerves is affected as a result of you being diabetic. Then we have uric acid. So uric acid is also another thing. So gout, someone will be having pain at the joints. These are inflammations at the unusual sites of the body. They all causes, so if you have it at the lumbar spine, you can get sciatica as a result of that. So these are some risk factors. So the risk factors are included in the causes. So old injury, if you have a history of an injury that affects it being in an accident or a heavy fall, you fall from a stairs or maybe a lift or any other thing, a heavy fall or an old injury, an accident that affected your lower back or your lumbar spine, you are at risk of getting this sciatica because we know the location of the sciatic nerve. So it can be affected as a result of that. Then aging. So we said aging, the bones weaken, or sometimes maybe when you are young, you can see that you did the hard work when you are young because you are very energetic, you are vibrant. So you could lift, you could bend, you could carry, you can do a whole lot of heavy works. But as you age, you realize that you are getting complications out of all those heavy things that you did. So aging is a result of that. Excess weight, obesity, we talked about it. So when you are too heavy, you don't check your body weight, you put pressure on some of the back muscles. So there will be strain, stress can be as a result of that. When it happens that way, there will be pressure at the lower back and you start experiencing some back pains and others. Then weak core muscles. So when these muscles too are very weak, there will be contraction and which will affect the nerves. Manual work, lifting, bending, carrying, you yourself carrying a heavy material, a heavy object without no one helping you. They are all causes of sciatica because sometimes you think that it's your hand doing the job, but it's your lower back that is affected. So you need to check that. Then we move on to the signs and symptoms of sciatica. So first of all, you experience numbness in the legs. So we know where the nerves are start from or originate from, the lower back through the buttocks, the hip or down. So you start to experience severe numbness. To the extent that some people experience it when they are walking and their slippers goes off their feet, they don't even notice it. So you have severe numbness. It's one sign of it. We have tingling sensations, pins and needle sensations. When you sit, you feel that there are pins under your buttocks or on the seat. You feel that in your feet. They are all signs of it. We have some shooting pain, pain at even the buttocks or in one leg. They are all signs of it, of sciatica. So severe pain, either shooting pain or any parts at the lower extremities, they are all signs of the sciatica. You feel heaviness at your lower extremities. When you walk, you feel you are very heavy at the lower side. They are signs of sciatica. You feel pain. So the pain can even be at the waist or the lower back. The lower back is in between the waist. When we take the waist, that middle aspect, it's known as the lower back. So you can feel severe pain. The pain can be constant at only the waist. They are all pain is one, weakness is another thing. Then you have burning sensations. You have burning sensations at your lower extremities, either at the feet, in the calves, in the thigh, at the buttocks, or the waist. They are all signs of sciatica. So please, all the causes I mentioned, like the herniated disc, the spondylolisthesis, the spondylosis, and others, most of them can be revealed through X-rays, MRI, CT scan, and EMG. So sometimes it's not your naked eye that you used to see that this person is having spondylosis, this person is having spondylolisthesis, this person is having this. It's through X-rays, CT scan, MRI that can reveal all these things to you. So now we can do physical examination. We ourselves, we seated, we watching. We can do, or whilst after the presentation, when you are home, you can do some self-test to check whether you are getting sciatica or is there and it's now coming. You can do all these things so that you can check where you are. Then you take immediate attention to it. So you can see the diagram. You raise your leg for this into this angle. So we have 0 to 35 degrees Celsius. We have this one and the others. So you check the range. It's not that you raise your leg like 90 degrees, no. So maybe within 35 to 75, you can watch from the diagram. You do that as soon as within 10 seconds, if the sciatica is there, within 10 seconds, you start feeling a sharp pain at your thigh or the femur. The back of your thigh is known as the femur. You start feeling some sharp pain at that side. So when you do this, or sometimes even the waist, The leg that you've raised, if it's the right side, you can feel a sharp pain at the waist, at the right waist. Or within 10 seconds, you feel that your legs have started shaking. There is severe pain. These are signs of it. So please, let's take note of this self-examination. Then maybe at our own time, we can do that to test ourselves. Okay, so please, I'm bringing my presentation to an end. So we look out to the prevention. We tell ourselves that we should exercise regularly. Exercise, the body needs to be exercised. So we need to exercise. In a day, you can exercise about 30 minutes, but we always say we don't have time because of our work and a whole lot, but we need to try our possible best and fix exercise into our itinerary for even the week. We have to try and exercise more. That when we do that, we take off certain stress, strain from some of the muscles. So the body needs to be exercised. So you need to check that. So we need to exercise regularly. We have to keep good posture when sitting. Always when we sit, we have to make sure that the chairs we are using supports our lower back. So when we take chairs like stool, there's no back there, you just sit on it. So if you sit on those things for a very long time, you start developing problem at your lumbar spine. So always we need to check our posture. Maybe you're always on the PC, you're always on the computer. We check your posture because poor posture can lead to the cervical problem, either the cervical spine, the thoracic spine, or the lumbar spine. So we check our posture very well. Then we have to use our body correctly. We shouldn't put pressure on one part of the body. Lifting, bending. Someone, maybe if you're a farmer, the person can bend for a very long time. For a long time after reading before the person will straighten upright and stretch, which is not helpful. So you have to check all this. Maybe we sit for a period of 45 minutes to an hour. At least you have to get up. You can walk for about 10 minutes. You go back to whatever you are doing. The same way when you stand for that period, you time yourself. You can stand for 45 minutes to an hour. You have to sit so that you'll be turning posture so that the nerves will be relaxed. Then there wouldn't be too much pressure on one part of the body. So we have natural remedies for sciatica. One, you have to get moving and exercise. We've talked about exercising. So if you watch television for a very long time, you time yourself. If you sit for 45 minutes to an hour, you have to get up. You can walk, it can be at the room, at the hall. You can go outside the compound, you walk for like 10 minutes, you stretch, you come back, continue whatever you are doing. The next 45 minutes to an hour, you have to get up. You do that. Anytime you do that, the next relaxes, there wouldn't be too much pressure. So you turning posture will help. So if you stand for that period, you have to do vice versa so that it helps. Then we have heating pads or ice pack. So with these ones, you see, we have this hot water bottle. If someone is having waist pain, you get this heating pads, this hot water bottle, you put it there. At least it will relieve you from the pain for some time without you taking any painkiller. But if it's in the acute stage, these things can solve that problem for you. But it doesn't work for everyone. So someone will try the heating pad and the pain will even get worse. The person has to try the ice pack, the cold one, and you realize that the person will be okay. So yes, so these two things, one will last longer for the person. The one that will last, then the person sticks to that. So heating pads is one form of it. Ice pack is another thing. Then taking garlic. We know that garlic is an anti-inflammatory agent that helps the body. So it helps regulate the nerves as well. So they are all natural remedies that we can try at home when we start experiencing or when we see some signs and symptoms of sciatica. We can try them and it can sustain us for some time. Thank you very much for coming.
Thank you, doctor.
You're welcome.
Please, any questions? You can either lift up your hands and you will call to sorry. You can either lift up your hands and then you'll be called, or you send us your questions in the chat and then we'll read it out to doctor for her to respond to us. So doors are open for questions. So anyone on board? Okay, Doctor, someone said, can you share your slide with us? So I don't know if you can put it in the chat for people. Yeah.
Hello.
Hi.
Yeah, I just want to in fact thank Doctor for such an impressive presentation. But I'm highly impressed the way she has explained things to details. I think that could have been the reason why some people are not even asking questions. Because to me, she explained every bit of the situations into details. We will not call for much questions. But what I want to find out from her, she did mention of burning sensation under foot.
Please, can you speak louder?
Hello. I said she talked about burning sensations as one of the symptoms of sciatica.
Yeah.
And what I want to know from her is, the burning sensation with your fingers. Actually, she has explained where the sciatic nerve is. And I believe strongly with our hands, our fingers, we don't have the sciatic nerve. So when you are feeling burning sensations on your fingertips, what could actually also be the cause? I just want to know that one.
Okay.
Yeah.
Okay. Okay, so please, with the burning, as I said earlier on, that this one we are dealing with the lower extremities. So the sciatic nerve is located at the lower extremities. That's the lower. So the burning sensation is one aspect of it, but there are differential diagnoses. There are other conditions that causes these burning sensations.
All right.
Yes. So if you have a problem with the liver, you can experience burning sensation as one part of it. Then if the nerves, so the nerves, I said there are about 7 trillion nerves in the human body. We are taking one part of it. So we have nerves in the fingers, in the arm, in the neck, other parts. So with the arms, it can be as a result of a lot of things. When your sugar goes high, you can experience burning sensations. Please, you get it. There are a whole lot of things. So it can be that maybe the nerves in the fingers are not working well, poor circulation, or something is going on, which can lead to that. Someone can experience burning sensation or pain in the arm as a result of high blood pressure. Yes. So as you knowing the cause of your burning sensation, you have to seek for immediate care. You have to visit a facility, a nearby facility, for thorough checkups to be done, so that we know the main cause of your burning sensations. Please, do you get it?
Yeah, I get it.
Okay, thank you.
All right, you're welcome. I appreciate it.
Please, any other question?
Godfred, your hands are up. So I don't know if you still want to, so you can go ahead.
Yes, please. Okay. Thank you very much for the opportunity. I have 2 questions. The first one has got to do with age factor. I don't know, but probably the doctor might have touched on that because I joined along the line. Do we have age factor in as far as the cause of sciatica? Do we have age factor in it? That is my first question. And if we have it that way, what do we do? Because if we have the age factor, there are some people who might not be able to do the type of exercise that we will need to do to curb or swerve, if I should say, this sciatica stuff? Yeah, and then the second one is do we have conditions that is similar to sciatica, so that we will have the clear line as to whether we are experiencing that? I don't know if my questions are clear enough.
Okay. So please, I'll touch with the second question first.
Yes, please.
Okay, so there are similar conditions
Okay.
related to sciatica. So with sciatica, we have a condition we call a sister condition, which is called piriformis syndrome.
Okay.
So it comes like the sciatica. We have a piriformis muscle that's indicated or is located inside the buttocks. So that muscle inside the buttocks is called piriformis muscle. When that muscle is affected, it's called piriformis syndrome. So someone can have sciatica the same time having piriformis syndrome. So the piriformis syndrome starts from the buttocks. That one, the waist is not affected. It's the same nerves that's compressing that. It's the same buttocks bone that's compressing that. So it will start from the buttocks inside the buttocks. The person will feel pain inside the buttocks itself, and it will radiate downwards. So the person will say that I'm having sciatica, but when the person has passed through examination, you realize that it's not sciatica actually, but it's piriformis syndrome. So it's similar to sciatica, but just that the sciatica will start from the lower back and will radiate downwards, whereby this piriformis syndrome will start from the buttocks, inside the buttocks, and it will radiate down, but it's the same nerves that we are dealing with. So when there is compression of this gluteal muscle, that's the buttocks muscle, when there is compression as a result of that, when you sit for long, it will presses that muscle and the piriformis muscle will be affected.
Okay.
Please, you get that one?
Yes, please. Yeah.
Please, the age factor, come again.
I want to know if we have a certain age that will increase the risk of someone getting sciatica.
Did you say age or age?
Age, AGE, like date of
Okay.
birth stuff. Yeah.
So actually, usually we say that maybe from 40 upwards, but now we can't say the age. The age will depend on the stage that you are, the kind of sciatica you are experiencing, your stage, or what you are experiencing. Because someone can be 20 plus and start experiencing these signs and symptoms, but treating the person wouldn't be difficult as treating someone in an older age.
Oh, okay.
Like 60 years going, do you get it? Someone will experience maybe age 30, someone will experience this condition as a result of hard work. So occupation has set in here. Due to the kind of occupation the person is doing, is demanding a lot from the person, and the person will get into this condition. But treating the person wouldn't be that difficult as someone in the older age. So usually it affects older age, but now per what we've seen, we've realized that some young 20 plus, the youth, they are coming small. And when you probe further, you realize that it's the occupation that has led the person to that, due to the hard work the person has done, which has triggered the pain, or due to an accident or a heavy fall, which has led to that. And some of the occupations like soldiers, police, the kind of training they go through, hitting their legs on the floor, standing for long, doing all these things, they are all factors. So someone can, as soon as you enter into such occupation, you are at risk of getting the condition. So it can come earlier or later in life.
Okay.
And please, you understand it.
All right. Yes, please.
We have, thank you, Doc. We have another question in the chat. And I read, please, what type of food can we eat to help us against this? Is there any food you have to recommend to us?
Oh, actually, fruits and vegetables are one. Then you take in more water. That's another thing. You avoid fatty foods and caffeine, too much caffeine. You avoid those things. I think that's best for now. So if you take in more of caffeine, you avoid fatty foods, you avoid late eating, you avoid all those things, and you take in more water and exercise. Fruits and vegetables are constant. It should be part of your diet, either after meals or in between meals. You take them and it will help regulate the system. Thank you.
You're welcome. Thank you all. Do we have more questions? Rooms are open for questions. You can lift up your hands or you put it in the chat. We'll read it for our doctor to respond to it. Oh, we are all okay with the presentation. Nothing is bothering our mind. One thing I'll recommend, if you've not heard of anything, one thing I could recommend.
You muted, Bernice.
Sorry. Yeah, any question again, you can either write it in the chat for us. Okay, there is a question. There's two questions actually. So let me read the first one. If your job of high risk is getting sciatica, but you can't stop, the work asks you have to put food. Okay, let me come again. It seems like the first thing. If your job is of high risk of getting sciatica, but you can't stop the work.
Hello, Dennis. Let me. I think the typing wasn't good enough. My question is, let's say if your job is it's a high risk of you getting the sciatica, but because you have to put food on your family's table, it's very difficult for you to also quit the job. So in this case, are you still allowed to work, or is there anything you can do? Let's say putting on belts or anything you can recommend to sustain you to be able to still work? Because most jobs you have to sit down. If you don't have to sit down, probably you would have to stand. And then we women definitely will have to give birth. So we are all high risk. So is there anything you can tell us for us to be able to, let's say, prolong us getting the whatever? Thank you.
Okay, you're welcome.
So please, during the course of the presentation, I said something that we talked about occupational rights. You can't stop the occupation, but if it's demanding a lot from you, now you have to be balancing yourself. You shouldn't be at a posture for a very long time. So I said something that if your job demands prolonged sitting or prolonged standing, you have to time yourself. If you sit for a period of 45 minutes to an hour, you have to get up. It can be in the office, at the hall, on the compound. You just take a walk for like 10 minutes. You come back to whatever you are doing. Anytime you do that, the nerves relaxes. The pressure on it relaxes. The same way that if your job demands prolonged standing, you do vice versa. So you can sit for like 10 minutes, you get up again, continue whatever you are doing. When it happens, the pressure on the nerves relaxes. So if your job demands lifting, bending, doing those things, maybe at first you can carry or lift a load of 50 kg alone. But so now if someone is there to help you, or if someone can support you with it, you can let the person help you hold it, because when someone helps you with it, the 50 kg, you alone wouldn't carry that. The other party has also taken some part of it. So when you used to do that, you need to adjust yourself in a way that it's not that you are stopping your job, but you reduce the stress on you. Please, is it understood?
Yeah.
Okay.
Yes, there's another question. I read, is there any chance of alcohol intake that can contribute to this condition?
Yes, please.
Okay, so
alcohol is a factor to the sciatica. It affects the nerves one way or the other. If not only the nerves, it's also due to the content it has. It also thickens the blood. So it makes circulation very poor. And it's like you taking toxic substance into your body. It damages other things in the body. So it's not just taking alcohol, but too much alcohol intake affects the nerves. It doesn't help it to work the way it's supposed to do. So it damages the way the nerves gradually. So it's not that you taking alcohol once a while or something, but if you are, it's a habit, lifestyle. If it happens that way, it doesn't help. Alcohol is a problem. So when you are even treating this problem, if you are in this situation, or if you are having any neuropathy, if you are treating it, any health professional will tell you that you have to avoid alcohol because it doesn't help. It will rather increase the pain. Once you are treating it, then it's triggering it. You taking the alcohol will rather trigger it due to the content it has. Please, thank you.
Okay, thank you too. There is another question, and the person is asking, is there a difference between the condition that's sciatica and the muscle pull? Is there any difference?
Okay, so muscle pull is a sign
us.
or symptom of sciatica. So the condition is the sciatica. So muscle pull comes in the form of muscle tension or muscle cramps or numbness. Let me put it that way. So it's a sign of the condition. So if you usually get muscle pull at your lower extremity, it's one sign. Some people will experience muscle pull. Some people will experience muscle tension. Some people will experience muscle cramps. They are all signs of the condition. So the condition itself is sciatica, but muscle pull is a sign or symptom of sciatica.
Oh, okay. Well noted. There is another question on the line. Okay, so the person has come again. Can regular sex reduce or prevent sciatica?
Okay, so with regular sex, I can't say it prevents sciatica. Neither can I say that it triggers sciatica, because in all these things, sometimes we say that sex is an exercise, but it depends on how you do it. Some people have their own motion or notion during that period or whatever they do. So sex, actually, if it's an exercise, it's just a normal, it's for pleasure. So doing it, depending on the state or maybe some way that you do it, which can affect you. So it's not once a while you have sex the normal way. It doesn't do anything. I wouldn't say that it will prevent sciatica, but it's part of us. It's something that we can do. It's a form of exercise. It relieves stress and others. So that's one part of it. But I can't say that it prevents sciatica or it triggers sciatica, depending on the way you do it. Because we say we should exercise regularly, but if you are in these states and there are some exercises that you do which will rather trigger the pain. Please, do you get my idea?
Yeah. Thank you, Doc. We are having a lot of questions and I'm really enjoying this lecture as well. So another question I read, please can it be treated that you will not experience it again? And then another person to ask, I have muscle pull whenever I'm pregnant and mostly my third trimester. Is that normal?
Okay. So please, the first question, can it be treated? Yes, it can be treated. That it wouldn't come again. And it's individual differences. Each person and how the body works. So depending on if you are in acute stage and it started and you rush to the hospital, treating it is very simple and it can go that it wouldn't come again. So your lifestyle or maybe any activity can also trigger it. If it comes again, sometimes when you probe further, you realize that it's something that has triggered the pain. So it can be treated. And in some stages, it's manageable. Let's say when we take the old age people, depending on some of them, maybe doctor has diagnosed them that they need to do surgery or something. They don't want to do it. So with that stage, it's manageable. As a result of you using the physio and medication, it's manageable, but it can be treated. So you can be in the acute stage and it can be treated and it will go, which wouldn't come again. If only you don't go back to what you did that brought it. Then the second question to I have Mazupu. Okay, so pregnancy due to the condition you are in. So it's through the condition because of the state that the uterus has been, due to the fetus, the growing fetus, or the enlargement of the uterus that has placed the lower back or the lumbar spine into a different posture. So whilst the lumbar spine has curved and it's in a different posture, it's putting pressure on the nerves. So I don't know whether with your own, when you deliver, it goes or it still remains. If I can know that, then we know how to go around it. So because the condition you are in, pregnancy is a condition, and sometimes after delivery, you are okay. But during that period, you see all these things. The numbness can be there, the muscle pull can be there, but after delivery, it can go by itself. That one is the condition that has brought that due to the posture of the spine during that period.
I think she has brought an answer. I said I only experienced it during pregnancy, but after delivery I don't have it.
So it's the condition, it's the pregnancy that has led to that due to the pressure from the enlargement of the uterus on the lumbar spine. So the lumbar spine has been into a state which is not supposed to be like that. So it's compressing the nerves, which is putting inflammation or pressure on the nerves. So after delivery, as soon as you deliver, the spine comes back to its normal state. So you wouldn't experience that thing anymore. So that's the reason. Thank you.
Oh, thank you, thank you. I saw a hand being lifted up. That's Godfrey. Is it for the first one, or you still have a new question for us?
Anyone, please.
Okay, so then you can go ahead.
Yeah, thank you very much once again. I am interested in the food aspect. I think Doc has given us some food that we are supposed to take as far as the sciatica is concerned. But can we go to the other side? Which type of food or item that we don't have to consume? Probably if we consume that one, it increases the risk of getting sciatica. If my question is well understood.
All right. So please, you see, sometimes you say, don't take this, don't take that, don't take this. But usually we check the portion of food we eat and the time we eat the food. They are all factors we need to consider. So you check the portion of food you are taking and the time that you are taking that particular food. So I earlier on mentioned caffeine. Anything that contains too much caffeine, it can be energy drinks. It can be coffee. They contain certain amounts of caffeine. You see, with coffee, we have some decaffeinated ones. But some people, it has been a lifestyle. They take it morning, afternoon, evening. So too much of everything is bad. And maybe a little drop of water makes a mighty ocean. So small, and then it becomes huge. So anything that contains caffeine needs to be checked. Maybe if you are taking it in excess, you have to reduce your intake. That's one aspect of it. So caffeine can be found in energy drinks, coffee, some painkillers, it can be found in it. So that's one thing of it. And if you take in more of red meat, you enjoy more of red meat, you have to check it. You reduce your intake. Sometimes you've not gotten to a stage that they will tell you that stop, but your consumption needs to be reduced. So if you enjoy that one more, you just have to cut down certain things. Then alcohol too is another thing. Too much alcohol intake, aside it being affecting the nerves, it affects other parts of the body or some organs in the body. So you just have to reduce your intake as well. So basically you have to exercise. So because if you eat too much, you become fat, you gain weight, and that one will also put pressure on some muscles, especially the back muscles. When it happens that way, the condition is likely to come because there will be some compression out of that. So please, if I've answered you well.
Yeah, very much okay. Thank you.
Please, are you okay with it?
Yes, please. I'm okay. Thank you very much.
Thank you too for your question. We have another one in the chat. So it's a follow-up question on the sex aspect. The person would like to know if there is any position that contribute to that condition, or Doc, if you can also advise us on the sex position that would not help to that condition. I don't know if you understand the question.
Please come again.
It said, so which sex position can contribute to sciatica, or which sex position could you advise us to?
Okay. So please, actually, I can't advise any sex position. So,
Okay.
but what we should take note of, maybe with this doggy position that we talk about, maybe we watch it, we know how it is, though. With that, maybe there is pressure on one part of the body when it happens that way. There will be pressure on one part of the body. So that condition is not usually advised, but I'm not saying that it's not good or it's good. It's something that if you usually do it, then it will lead to other things. So I can't advise a particular position that will help or wouldn't help. It's just that maybe that's what I know per my experience. That's what I know, or per my field. What I can talk about is the doggy position. It's not that it should be avoided or something, but maybe with that one, that when you usually do it, there is pressure on one part of the body, which will lead to other things later on in life. Thank you.
You're welcome. I think we have to have part 2 of this because I'm really enjoying it. There's another question that someone have asked, and that one too is a follow-up question on the muscle pull. Is that with the muscle pull, I want to know if you exercise for long period and it bring pressure on the muscles, does it mean you have sciatica, or there is a likelihood of you getting sciatica?
So there is likelihood of you getting sciatica. It could be that the exercise you are doing is rather putting pressure on the nerves, because some people lift weights, the heavy substances, as in a form of exercise just to build muscles. By you doing that, you are building your muscles though, but you are putting pressure on the lower back or the lumbar spine. So it's a form of exercise you are doing, but at the end, you get something else from it, something negative out of that. So you can experience this muscle pull, though you are exercising, doing the best, but maybe the kind of exercise you are doing is rather putting pressure on the knee, whereby it needs to be checked and advised. Thank you.
Thank you, thank you. I think we'll have 1 or 2 questions, and we'll draw our curtains to a close. There's this question in the chat, and the person is asking, is blood group of individual a factor of sciatica?
Okay, so with the blood group, it can be and it cannot be. With that one, I'm not really certain about that because it's individual differences. Sometimes maybe you can advise blood group, oh, this particular person shouldn't take this person can take this. Maybe what you will advise this person not to take, that would be the good thing to another person needs to take, but they are with the same blood group. So with the blood group, actually, it has a whole lot of factors that's not really leading to sciatica, but it can be as a result of due to what you are taking into the body. So sometimes maybe some people would like to know the kind of food they are supposed to eat depending on their blood group. But some of them, if you advise they are not supposed to take it, they are supposed to take it, it will work for them. some people to one way or the other, maybe there is an underlying condition there, whereby if you advise with what they are supposed to take, it wouldn't help them. So it's associated with other things. So not really, it's not a main factor that you consider it being leading to sciatica though, but there can be other things. We will look out to other things, it there being underlying condition, maybe other factors before you can draw the line that this person, as a result of this blood group, you are not supposed to do this, or the blood group. So the blood group per se is not really the cause of sciatica, or it's not the main thing. There can be something else in relation to that. So we can't solely base on the blood group as it's leading to sciatica. If you get me right.
Well understood. Do you have any question again? You can lift up your hand, or you put it in the chat. We're ready to talk for her to just explain it to us or answer us. Or we are all okay. As at this point, we are okay.
Yes, I think we are.
Okay. Then God would like to say a very big thank you to you for your time you spent to enlighten our understanding on sciatica, what we can do to prevent, and then if we have it, what we can also do to work on it as well. So we'd like to say a very big thank you for everything, for your time, especially. I know doctors, they don't really have time, but you having this great time for us. For you having this great time for us, we said God bless you as well. Yeah, so that you can get more, and then whenever we call on you, you can just answer and respond to us. So without much ado, we'll be taking our closing remarks. So I'd like to hand over to Augustina, if you're on the line.
Yes, I am. Thank you, Dede. I think you did part of my job for me. Thank you. You made it easier. You did a good wrap up at the end. And thank you, Doctor, again for your time.
Thank you.
Like Dede said, doctors can be really busy. Sundays, making time within your Sunday time for us. On behalf of Jesusina Foundation, we would like to say a massive, massive thank you. From the beginning, when the questions were open for people to ask, it was a bit quiet. I was thinking, oh, and then when the question started, it was never ending. Amazing. We've really enjoyed the session. Like Dede said, she will love you to come back again. You've made it really, really easy to understand the whole topic, although it had your massive words, scientific words, but at the end of the day, we all really understood what it meant to make the session so interesting. Thank you so much. And thank you everyone who made time to attend the session. Looking at our number, wow, 35, amazing. Let's make it bigger next time. Invite more people based on what you've witnessed today. It's so interesting. So next time when we invite you to come to our health sessions, please do invite family and friends, so that I'm hoping next time we reach 100. It will be great to bless each other. And also the center is opened tomorrow. The food bank, the usual center, please do come and save money. Thank you all very much. Have a blessed week and see you soon. Thank you. Bye.
Bye-bye. Thank you, everyone. Thank you. And see you once again.
Thank you.